There we go. Ladies and gentlemen, you're listening to the We Be Free radio show, Brain Food from the Heartland, and I am so delighted to have returning to the show, Cynthia Fisher, founder and chairman of Patient Rights Advocate.org. Cynthia, I'm delighted.
Louis, it's so fun to be here again, and thank you for having me on the show.
Always. I love doing the gig with you. Your background, and I always ask you your background for new listeners. Free Patient Rights Advocate.org.
Yes. Gosh, Louis, it was 32 years ago that I founded an organization in Ohio, and it was medical service named Viacord.
Founder?
And we founded it in Cincinnati, Ohio, and that's where our lab was with the University of Cincinnati. And we banked umbilical cord blood stem cells, and the company still exists today. And it was acquired by PerkinElmer. And from the very beginning, we banked cord blood stem cells as an alternative to bone marrow, so that anybody having a baby could preserve this potentially life-saving material for treating with stem cell therapy cancers like leukemias, certain genetic disorders like certain anemias. We did the first sickle cell transplant, for instance, for a little girl from Boston who's doing well and alive today, drug-free, just, with her healthy blood and immune system. So we were able to provide umbilical cord blood stem cell banking, and we did it where we were price transparent. One price, one patient, all patients, anybody who banked their child's umbilical cord blood paid the same price, no matter where they were living in the world. And they also had the advantage of having every quality data open to them to understand quality, as well as every use of the cord blood published with outcomes when I was leading the company. So yes, it still exists today. Thousands of lives have been saved with umbilical cord blood stem cells as this alternative bone marrow. And now I'm in Washington, basically taking this knowledge of how we can lower the cost of healthcare by every provider, every physician, every hospital, every insurance company being price transparent and quality transparent, and allowing all patients to be able to lower their costs by knowing the actual prices in healthcare before they get care, and when they get their medical bills, to make sure they have not been overcharged, upcoded, or put into egregious medical debt unnecessarily.
And I know we've talked about a lot of examples over the years that you and I have spoken. I've got to ask you, Cynthia Fisher, your ethics. Where do you? I know it's an odd. Somebody said to me, I don't know. I mean, I can attribute it to my parents. Where do you think your ethics come from? Again, way back, starting the company, you wanted to make sure the pricing was the same, it was fair, it wasn't. And now with your drive with Patient Rights Advocate.org, same thing. And you don't need to do this. This isn't something. This isn't a business. This is a effort. This is a.
Yes, I know you could call me crazy, because this is philanthropy for me.
Yeah.
I'm spending the monies that I was able to make fairly. And, our Viacord service was 1/6 the cost of nonprofit comprehensive cancer centers or blood banks that competed with us. And yet we provided the gold standard. So we were the go-to, and have been the go-to, for the stem cell transplant programs with, like, the Fred Hutchinson bone marrow transplant program or Children's Hospital, because we were quality and outcome and price transparent, and we could charge a fair price and yet still do well enough, And I think when it goes to ethics, ethics, to answer your question, it does come from your family values. I mean, it's not hard to wake up on the side of the angels, Louis. It's harder to nod and to do the right thing and be mission driven. And, your core values is to serve and to provide transparently, exceed expectations by providing the best value of service or care or product. And it's not hard. Every other facet of our economy We know prices.
Yeah.
We can compare quality. That's how market economies work. And unfortunately, our healthcare system has been so broken that it's not hard to do the right thing by simply having a fix. The fix is you have to know first the prices, and then people want to know what they're going to get for that price, which is the quality and outcomes. And this is how you have a fair market economy. But there is no fair market in healthcare when the consumer is blocked from the information, and we're blind to no prices, blindsided by outrageously overcharged medical bills that don't even match our medical experience. And then whenever we get care, we have to pay with a blank check and agree that they can charge us whatever they want. Well, it's game over. I mean, this has changed, and it's the time for the American Revolution in healthcare, because price transparency is now our right by law. And that's huge.
Cynthia Fisher, give one example. I know you've given a number of examples. You pick one.
Oh gosh. Well, let me give you an example, because, if you ask any of your listeners, almost everyone will raise their hand and have a story about being overcharged by the medical system, getting bills. Every bill's a surprise when you don't know the prices beforehand. And most of our medical services are planned. Even when we can see prices, we'll know when we have emergent care, which is less than 10% of the time people go into emergency rooms instead of a planned visit, then those prices will have to compete on fair market. And so, when we look at what we've seen happen, for instance, we have a woman right now who came to us who had a hysterectomy, went to the hospital. They said they accepted her insurance. And in fact, what they did is, after the fact, they told her they didn't accept her insurance. And she's responsible for $74,000 for a hysterectomy.
After the fact.
No complications. After the fact. And so this poor woman, the hospital's ready to put a lien on her house. They're going after her with medical debt. And she just retired at 62. So she bought an insurance plan that she thought was a good plan, but she found it had a carve out for hysterectomies. And she had no idea it was in the fine print. And worse than that is that the hospital pricing, now that hospital prices are the law, that every hospital has to show prices online before we get care.
Federal law. Forgive me for interrupting. A federal law.
Federal law. And guess what? It was 2 years ago that this law came into effect. It actually was in Obamacare, and it was sitting dormant. Believe it or not, we got 3 presidents, Obama, Trump, and Biden, all supporting price transparency from hospitals and health insurers. Okay. And yet it didn't become rule of law until the Trump administration found it was collecting dust, and it was never converted into a patient's right by rule of law. So the Trump administration got that done, and it became our right as of January 1st, 2021. And most of the hospitals, sadly, are not fully complying with this law and hiding their prices and gaming it by having incomplete files online. So we are looking at that, saying this is preventing, Louis, it's preventing the tech world and software tools from letting Google allow us a search, for instance, where in the Cleveland area can you get an MRI? And how much is it going to cost? So who's available and at what price? And what you'd find is you can get an MRI for $300. And many of the hospital systems will not show their prices. And those MRIs, even with an insured rate, can be in excess of $6,000 all in. So when you can get a radiology read plus the MRI all for $300 at a standalone imaging center, why wouldn't you save your money? Because MRIs are more or less commodities at this point. And when everybody can save, it makes a huge difference. And so I'll give you an example. We know of this woman who was charged $74,000 for her hysterectomy. And when we went online and we looked at what is the discounted cash price for that hysterectomy, it was $19,000 all in, including the surgeon's fee and anesthesia. Okay. So how is it this poor woman is being put into egregious medical debt, And she never had the pricing to show her. In fact, they way overcharged her by more than $50,000.
It's outrageous. And I want to talk about some of the hospitals in Ohio because, and again, if people go to your website, patientrightsadvocate.org, of course, we've got all the links up. They can read any state and find out. You've got the reports up there. I just want to make a couple of quick comments. Noah says, Cynthia, I admire your aspect, dedication, and more. I wish there were more people like you who realize this about healthcare. And he also said, as a patient with multiple disabilities for 20 years, he said, what you're doing is absolutely amazing. And again, the price difference, thank you, Noah. And the price difference is
Thank
just,
you, Noah.
yeah, I'm sorry. I know personally, having had a lot of medical tests over the last year, the prices can be, you're stunned and not finding out and trying to find out and trying to search it. It's difficult. It's difficult. But let's talk a little bit. Again, this is a federal law. So there's so many in Ohio and across the nation, certainly, that are non-compliant. And I have to say that if I'm non-compliant with federal law, I've got issues, right?
Absolutely. If you speed and you're caught speeding, you're going to get a ticket, right? And you're going to pay the fine. Well, unfortunately, Health and Human Services Secretary Becerra has not enforced this law. And it is the the federal government has this rule of law. And even President Biden supported what President Trump got done using the Affordable Care Act that came from Obamacare. This is in law for it's now 13 years. So, I had a Jewish friend joke yesterday that Affordable Care Act has had its bat mitzvah or bar mitzvah, it's 13 years. And this has been sitting dormant until the Trump administration said, wait a minute, everybody has the right by law to know these prices and benefit from a functional and competitive marketplace where both hospitals and insurance companies should have to compete on price and quality, right? That's our right. And it wasn't being done. So they got it done. And then Biden said, we got to up the fine because these hospitals are not in compliance. They're not making it easy for every patient to know a price. Know before you go. So he upped the fine. Biden upped the fine to $2 million. But sadly, his Secretary of Health and Human Services has only fined 2 hospitals. And we found outrageous last year. As soon as these 2 hospitals were fined over $1 million, guess what? They came into compliance, posted beautifully all of their prices within 2 weeks. So it's so easy for them to be able to comply with the law. It's inexpensive. It's simply posting all of these prices on the website. And when they do, think about the future, Louis. Think about what will happen for all of us, where we'd all be able to start to Google search or use tools like Priceline or Kayak, like using for airline prices. We'd get to see the wide price variation and the choices based upon supply and demand and negotiated rates with insurers. And guess what? When employers see that their insurance carrier negotiated childbirth at the Cleveland Clinic, for instance, perhaps 10 times more. We've seen it at Sutter Hospital in California, that one woman's C-section, no complications, was $60,000. And another woman on the same day with the same obstetrician and team, same coding, was charged $6,000, 10 times less. None of us would tolerate paying 10 times difference from the same hospital on the same day for the same service.
For any sir. I mean, it's, I think that's, and again, it's outrageous. When you go into the grocery store, you know what the price is, as you should. You shouldn't have to go to checkout and then find out, wait a minute, that was, or get home and look at I want to say Cleveland Clinic, I dare say I am surprised how many of their hospitals are non-compliant.
Yes, well, Cleveland Clinic, the main campus, is fully compliant. And our report looked at, this is our 4th semi-annual report, since the beginning of this rule becoming law. What we found is only 25% of the nation's hospitals are fully compliant, posting all of their prices by every insurance carrier and plan that they accept in their hospital, as well as the discounted cash price. Do note, a sidebar is oftentimes the discounted cash price, is the big secret, is far lower than even the insured rate. One has to wonder why we even have insurance if they're negotiating a bad deal for us, right?
Absolutely.
And why don't employers go to a debit card, direct pay for their members? You know, when they start to see these prices, they're going to be outraged. And so if you look at Cleveland Clinic, their main campus has done a fantastic job.
Yeah.
They've been on a merger and acquisition spree, right? Buying up other hospitals. Some of the other hospitals they bought or some of the others under ownership aren't quite there on having all of that data available so that a tech developer or you or I could easily find prices.
And I'm delighted about, main campus and just some of the outlying. I'm not sure why Mercy Health across the board seems, again, I'm looking at the point, non-compliant. St. Elizabeth, Boardman, non-compliant. Mercy Health, St. Elizabeth, Youngstown, non-compliant, and it goes on. I'm stunned by that. I know Mercy's big, but so
they can go further. What we're seeing is either large swaths of prices missing with dollars and cents. We're also finding that they accept far more insurance plans and carriers within their hospital that they're not showing all of the prices by every comparative plan. That means you can't see the competition. Okay, so if they're only showing a few or they're not totally compliant, we can't see comparative prices and see the wide price variation that's happening. So again, almost there, but it almost isn't good enough. You actually, in order for all of us as consumers to have this information parsed and put into easy mobile apps and easy comparative shopping tools for our employers and the unions that purchase health plans, as well as all of us, to be able to shop. I mean, why should anyone get an MRI and pay north of $6,000 for it when they could see where they could go conveniently and get it for $300? I mean, it's outrage.
Yeah, it's a big difference. Again, it's not that it would be okay if it were small differences or negligible. Yeah. These are huge differences.
Yeah. And Louis, let me tell you how serious it is for employers. I mean, even in Trenton, New Jersey, we were asked with 17 unions to go protest with them to see price transparency because their insurance, every one of those unions' insurance went up north of 20 to 24%. The police unions went up 24% this year alone. That's way above inflation. And so the hospitals and the insurance companies are sort of in this together, keeping prices hidden, right? So that they can actually charge way beyond a reasonable amount, even way above inflation for coverage. And that comes right out of our paychecks. So, what we see happening in the periphery, which is so exciting, is school districts like Ashtabula, the superintendent, Mark Potts. He went and demanded all the claims data from the insurance carrier to see what they were paying and compare where they were being overcharged. And he was able to rip apart their plan and the hospital pricing data. And what he was able to do is save over $2 million in the first year for the school district by just being able to over $2 million.
Echoing.
$2 million in Ashtabula. That's real money, Louis. What he found is where they could get a knee replacement, for instance, for $19,000 all in. Okay, surgery, anesthesia, everything all in. And he found at some of the hospitals that his teachers and administrators were going to were charging north of $67,000 to $80,000 for a knee replacement, and an opaque system that was hiding its prices. So what he was able to do is basically encourage through bonuses and support to go to these quality, price transparent, guaranteed prices at $19,000. And he was basically able to save a teacher's salary for every knee replacement. I mean, think about it.
That's
That's
huge.
crazy money.
That's huge.
Huge.
That's
Huge.
huge. And
Yeah, so he was so excited about it that he's now trying to do this with 600 schools in Ohio
that's
to be
fantastic.
able to save millions of dollars from their health plan every year.
Yeah, that's big money, and I'm glad that he's that dedicated doing it. I'm talking with Cynthia Fisher, and she is the founder and chairman of Patient Rights Advocate, and again, patientrightsadvocate.org. I'm just looking. I don't know why I didn't do my homework well. I'll have to sit in the corner or something. But in Western Pennsylvania, I'm looking at UPMC. Again, these are, I'm going to say, revered hospital systems in Northeast Ohio, Western Pennsylvania, and probably certainly beyond. But I was stunned. It's like, really? Now it's federal law. I understand whatever you did before or didn't do before, you did or didn't do before. It's federal law, non-compliant, one after the other, non-compliant. Folks, go to the website. You can read any state. You can read the full report, any state. Read about it. I was stunned with that. I was delighted about main campus with Cleveland Clinic. I would like them to catch up with some of the other ones. I was very disappointed with Mercy Health. And now I'm looking at UPMC, and it's how can it be? It's federal. Like I said, if I don't follow any law,
right,
I hate to say, especially federal law, I'm in trouble.
Right. Absolutely. Every individual citizen's in trouble when we can't get the prices to healthcare. I mean, the fact that this case that I told you about, the woman with the hysterectomy who should be charged more than 50,000 less. Well, we're helping her with that because she had the right to know prices, right, before she went, and she didn't get access to them. She had the right to know and not be fooled that her insurance carrier was going to have a carve out for her hysterectomy by both the hospital and the insurance company let her believe beforehand that she had that covered as well. And then to be overcharged to $74,000, just a physician was $8,900. And when she pressured him to say that was a big overcharge from what she could see in other prices, he knocked down his price to $1,300. Wow. Okay, so hello, the beauty in prices is for everybody who has medical debt, for everybody who hospitals have sued or they sell off to collection agencies, the debt. They try to sue these patients at funny numbers that are way higher than actually the services rendered should be priced or negotiated at. And so everybody has the right to fight those lawsuits now and say, no, don't garnish my wages or take my home because you never gave me the price. And everybody should fight to get that. We have to be our own advocate because no one deserves to be overcharged and have their bank accounts and their homes robbed by the healthcare system that is keeping patients in the dark. And remember, Louis, when I was on your show before, the hospital sued the Trump administration to keep prices hidden from patients. They tried to use the First Amendment to say it was their right to keep them hidden. And to protect consumers, both in the lower court and the upper court, the patients won, hands down, and the Department of Justice won that we have the right to know prices. It's our money, and it's our wages that pay for coverage, and it's our savings that pay for our out-of-pocket costs. So all of this is our money, no matter how you look at it, and we have to step into the big girl and big boy boots and demand hospital prices to fight the overcharges and then to prevent overcharges by getting the prices before we get care.
That's fantastic. I love your dedication to helping people. And again, it's patientrightsadvocate.org. Cynthia Fisher, what can we do? What else can we do?
Well, I'm going to touch on something exciting that's happening. Is you can write your state legislatures and state congressmen and women in Ohio, because Ohio is so fed up that the hospitals in Ohio are only at full compliance at 18% right now, where the files are very easy to read, okay? And that's less than what we're seeing nationally. And so the legislators have a proposed bill right now to essentially enable people to be protected and from medical debt, so that if the hospitals aren't showing their prices, the bill is that the Ohio bill would require all the hospitals to post all their prices and limit collections if they don't have the prices. This is huge. And so, this is bipartisan. My goodness, it's an equity issue, because no one in their health plan should pay 10 times, 3 times, 5 times more. Everybody ultimately should pay a fair market price, but no one should be sued or put into collections or claims without getting prices from these hospitals, because they're not complying with federal law. So the good news is it's the bill called HB 49, and it's codifying the federal price transparency law, and it's going to prohibit hospitals from assigning medical debt to debt collectors, and it's going to prohibit them in state court to obtain a judgment to patients against outstanding medical bills if they're not actually being fair and showing all the prices beforehand. It's huge.
So people need to get active, and they can get your newsletter. They can get more information, certainly at patientrightsadvocate.org. There's
exactly
your social media, et
exactly. So there's an Ohio legislation. There are many other tens and tens. Well, we see over 18 states right now that are saying they're fed up that the federal government has not been enforcing this law. They want to protect their constituents, and they're working to do this consumer protection and demand the price transparency from the hospitals. And so also in federal law, Congress is also putting pressure on this administration to enforce the law and enable a free market, functional, and competition to be unleashed. And to stop the $15,000 EpiPens we see. Sometimes we saw that
remember
a $15,000 EpiPen, the insurance negotiated at a $4,900. Well, isn't it because that poor 20-year-old college student had a $5,000 high deductible? When he looked online, that hospital happened to be price transparent, and he found that the negotiated rate was $300, not $4,900.
Outrageous. These are big differences.
It's huge. And it's life-changing. This is life-changing for people to have control over their financial health when they seek health care, as well as their physical and mental health.
Yeah, and the worry and the concern, and should I go? It's going to be whatever, and just the idea that, like you said, the mental health too of somebody worrying or getting anxious about it is awful. And then how many people have to go into bankruptcy because of medical debt? It's outrageous.
It is outrageous, and just so people know, they have to challenge every medical bill. They really have the right to do that, to write the hospital, ask for the price list. Because when you get that bill, they're going to fight it. They're going to try not to. And you just need to say, it's my right by law to have access to the itemized list of all of these prices by code, by clearly named code, to know if their medical bills are accurate. And I will tell you, most of the time they're not. Most of the time, the hospital systems hire firms like McKinsey and others to help them optimize revenue cycle, to figure out how many codes they can charge and upcode to make as much money as possible. And Louis, we're not in this world of sisters of charity, right? Running our hospitals. Our hospitals are big businesses now. They're advertising. They run the NASCAR advertising. The Daytona Beach was done by a hospital system. Why is it Mass General in Boston is advertising on Florida golf tournaments? Right? I mean, these are big businesses that are billion-dollar enterprises that are building billion-dollar glass atriums that are bigger than any crystal cathedral in any city, right? And it's not the doctors and the nurses that give us the care. Those doctors and nurses are dedicated to curing, treating disease, research, making sure we get the best outcomes. But let's be real. Anytime you can't find a price at this stage, 2 years into the law,
federal law,
and if all you need to do is look at Health and Human Services and look at their chiefs of staff come from the big lobbying organizations, from the Federal Hospital Association, the American Hospital Association, they're right there making sure that their special interests are protected. And that's all working against the consumer. So we have to, as consumers, start to demand these hospital prices And as employers, get the claims data like Mark Potts did, and many of the employers in Ohio are starting to ask Blue Cross Blue Shield for their claims data. It's their right by law. They're finding out some of these insurance brokers are making 20% on their $30 million spend on healthcare for all their members. What? That's all negotiable, right? When people start to reveal that an insurance broker is making that kind of commission year after year after year,
every time
it's not like your real estate broker makes it one time on the purchase of your house, right?
That's a good point.
Money. So when we pull back the curtains, the great reveal is showing that there are many, many mouths that are in middle players and insurance carriers that are capitalizing on our misfortune. And the employers that are saving money are directly getting access to prices, cutting out those middle players, and lowering their costs by 30 to 40% for all of the workers under that plan. And they're giving bonuses, and they're also giving higher wages with the savings.
Which
is
is
beautiful. It's how a free market's supposed to work.
That's how it should work.
Right.
I love your passion for what you do. And again, hopefully we can do a part 2 in the next, if I know you're busy. I know you're busy.
Hey, I'm never too busy for you, Louie.
Thanks.
You know, this is about getting the message out so people can not be harmed. And no one should accept medical debt without having price lists and comparing to see what's the fair market price. And anybody who's making 2 to 4 times the poverty rate and below should be getting access to financial charity care from that hospital. That's the law. That's how they keep their nonprofit status. And the hospitals are not offering it. They're not offering it. People don't know. So we're putting a megaphone to our rights to save our money and our rights to see fair market prices. And God willing, everybody gets an MRI for $300 in the future, because we know it's a commodity, and we know that hospitals and insurance companies and independent imaging centers, they're still making a profit at $300.
They've got to. So that's fantastic.
Right.
That's fantastic.
It's huge. It's huge.
And you see some of the bills, and some people have emailed me about some of the bills they've gotten. Maybe we can talk more about that next time. But if people go to patientrightsadvocate.org, a wealth of information, patientrightsadvocate.org, folks, get involved, your Congress, etc. We've got to do this. And I love your passion, dedication, and humanity, sense of humanity, Cynthia Fisher.
Thank you so much. We can get this done, Louie. Thank you.
I know that. I know.
We're farther ahead than we were last year. Last time I spoke to you, we were at 14% compliance. Now we're at 25%. But when we have the tech economy, when we have the tech world, be able to strip this all apart and show us all of this pricing data, and all of us start to shop, and all of us start to prevent being overcharged with those medical bills, that's our win. It's our money to save.
That's right.
And it's power to all of us as patients.
Power to the people. Power to the patients. Power to the patients, right? Thank you, Cynthia. I love doing it.
Thank you, Louie.
We'll do it again soon. Thank you so much.
Thanks for having me on the air today.
Thank you. Thank you. Ladies and gentlemen, Cynthia Fisher, again, I love her. She's amazing. And her dedication